The Netherton Syndrome is classified as a kind of skin disease that's called ichthyosis. It's a genetic condition and we don't currently have a cure for it. When babies are born with Netherton Syndrome, they're often very red all over and they may have dry, flaky skin. So it's usually pretty apparent at birth that the baby's skin isn't normal. It's not just the way the skin appears, it's actually a very serious medical condition, and there is associated mortality with it, particularly thinking about in young babies and small children because of the sort of metabolic requirements, increased susceptibility to infection. Initially, just having a supportive clinical team around you that appreciate what a devastating shock it is for those parents, but also going forward to help the parents come to terms with what day-to-day life might mean and how to manage that child. So fluid is one thing that babies need particular attention to, because when you've got a red skin and when your barrier of the skin isn't working properly, you can often lose a lot of fluid and that can make you dehydrated. But the other is the increased sort of energy requirements. If you've got red skin, your body's working really hard to pump blood around the body, and so your metabolic needs are much greater. That all contributes to the difficulty in those babies gaining weight and in maintaining that weight throughout their sort of infancy and into childhood. With Netherton syndrome, this is a lifelong condition that requires intensive treatment every single day, bathing, creaming, trying to sort of reduce the risk of infections. So it's pretty relentless. At the moment, we don't have more effective treatments. So as a clinician, that puts you in a difficult position when you've been looking after people for 20 years and you haven't got anything else to offer apart from a ton of moisturising cream. To actually have the prospect to be able to do some proper research and to try and find more appropriate targeted treatments is brilliant. So I'm sort of delighted that the landscape is finally changing and actually might have a bit of light on the horizon for people living with this devastating condition.